Okay, so good morning, good evening, good night, doctors, nurses, and pharmacists, all of you. So I am DrChe, and today we will discuss some important writing tips. Okay, so we will discuss a letter, we will write together, and then I will mark your letters. Okay, so just let me see the free session here on Facebook. So if any of you wants to join is on Facebook, yes, you can also join on Facebook. Just let me share the session, then we will start. Okay, if you can share this session with other doctors, nurses, and pharmacists, that would be great. Okay. Okay, so just 1 minute. Okay, just 1 minute. I'm going to share the session, then we will start. Okay. Okay, thank you so much for waiting. So let us discuss this letter. So can you see case notes on my screen? You can unmute now. So can you see the case notes on my screen? Okay, good. So these case notes are written by myself. Okay, by the way, if there is any problem with copyrights and these things, you people know I mostly get problems with copyright and these things. Okay, trademark and okay. So first of all, whenever you get a letter in your real exam, you will have 5 minutes reading time and you will have 40 minutes to write the letter. Can anybody tell me what does this mean by 5 minutes reading time? Because they can give 45 minutes in total, but why they give separate 5 minutes and then 40 minutes for writing? Anybody can explain me? Any of you can
In
explain,
this
please?
5 minutes, you cannot like highlight any words. That's why, and you cannot write also during this 5 minute time.
Okay. Yeah, good. Okay. So in these 5 minutes,
I
yes,
think also
yeah,
planning for what the relevant and
yeah.
irrelevant information.
Okay, yes, you can plan in your mind, but you can plan in your mind. You cannot use any pen or pencil in this time, okay? In the 5 minutes, you cannot use pencil. You cannot use anything to write. Okay? So you cannot even pick the lead pencil, okay? Because in the real exam, you will use lead pencil, not the ballpoint. So you cannot even pick the pen, pick the ballpoint, pick the, lead pencil while you are reading for 5 minutes, okay? Just reading without anything to write, okay? So what you will read is, so first you need to see, this is today's date, your doctor, nurse at this hospital, read the case note. Mostly you don't need to write it, just it is quickly, okay? So then you don't need to read the details here, you just go to the task, okay? Read the task. So the task is using information in the case notes, write a letter to DrChe, patient's family physician, for further care and follow-up, okay? So this is the name of the doctor, general physician, name of the clinic, okay, and address. So you can see that here you are writing to patient's family physician, okay? Anybody can tell me what is the importance of this when we are writing back to patient's family physician? What is important for us to know?
Yes, sir,
It
because
does.
it is important that we don't need to mention the previous history because the physician already knows about it.
Okay, very good, excellent. So mostly the past medical history, chronic history, the GP mostly knows, okay? But sometimes there are some, little bit changes. You don't need to make a strict rule for that, but mostly is like that, okay? So the GP knows about these things. So, but in this letter, let us see what happens, because just we know that we are writing a letter, discharge letter to patient's GP, okay? So this is name of the patient, Daniela White, okay? And this is on 24th of 11 when I have written the case notes. And today is
slide plus.
4th
Now,
of December. Please mute. Okay. So patient's name is Daniela White and gender is female. Date of birth is given here and age is given here. So I have written both of these things. So will you use both of these things in the greeting, or you will use one of them?
One of them, sir.
One of them, okay. So if the age is not given, for example, if the date of birth is given, age is not given anywhere, not here, not in the, conclusion, mean the task. So do you need to, I think I made a mistake, 2082, no, is 1982, okay. So do you think you need to calculate the age?
No need.
So we can just right
No,
away
sir.
write
No.
the
I think it's
exactly.
no need.
Yeah, just write the date of birth, okay. You don't need to write, calculate the, age and write in the purpose, okay. Mostly students start writing, calculating, okay, the 82 and to nowadays we are in 2022, so it has 40 years. Don't calculate, okay. If it is written, just use, otherwise don't, no need to calculate, okay. So patient has a history, of snake bite. You think married, lives with children, works in as architecture in DrChe Institute, hobbies, painting and camping. Do you think is any of these things important when we are writing back to patient's GP?
No.
Are not important, okay? These things are not important. So this is what we are doing in the 5 minutes reading time, okay? This is what we are doing in 5 minutes reading time. Okay. So next is a patient smokes cigarettes and drinks. Do you think is important for this letter?
No.
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 No. Okay. So if the same letter I change that patient has, uh, suspicion of possible lung cancer, then do you think, and you're writing a referral letter to respiratory specialist, do you think it's important to mention this smoking?
Yes,
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 it is.
Yes.
very important.
Very important. Okay, you can see how the things change when according to the case. Okay, so you need to think according to the case. Okay, allergies, surgeries is important? No, not important. Okay, chicken pox, chronic sinusitis, and vaccination stations. So all of these things are not important. Okay, vaccination status can be important because we have given the tetanus dose. Okay,
Mm.
and when there is a bite by animal, okay, like cat, dog, snake, okay, we use tetanus vaccine. So maybe it could be something important, but as we have already given the tetanus vaccine, so I think so is no need to mention, but this is something that is optional. We can mention if you wish, okay? And what do you think about family history of diabetes and hypertension?
No need.
No.
There is no need, okay? If father has diabetes and mother has hypertension and gout, it's not important to mention because patient is having, you know, snake bite. This is just something acute condition. Okay, now the same letter means just the case would be different, but the family history, past history is the same. If I change this and I write a letter of referral to other GP, means patient is, for example, you are living in Birmingham or you are living in Manchester. Now the patient is moving to live with his family in London. So the patient will go to new GP after he leaves from Manchester. So do you think it's important to mention the family history here?
Yes.
It could be a
Yes.
community nurse. It could be a referral from one community nurse to another community nurse, or one GP to other GP. Okay, then it is important or not? Even patient is not having diabetes, patient is not having hypertension or gout.
It's important, sir.
Then is important because these are the risk factors. Patient can develop these things in future. So if you're writing to GP, okay, so the things change according to the situation. So now let us see the main thing, what happened now. On 20th of 11, you can see the time. Sometimes we
Yes.
get case notes in the real exam with the
Morning.
time also, okay. So what happens at 10 a.m., snake bite on right foot. You can see I'm writing snake bite on right foot. Why? Because you need to change it into a sentence. I cannot write, directly the verb and these things here. Just I'm giving the clue, okay? So you need to make it, change it into a sentence, okay? Camping in desert. Camping in desert means he was bitten by a snake when he was camping in the desert. So this is how you will change into a sentence, okay? The examiner, the examiner will not give you like a sentence. They will give you just points, bullet points, okay? So you need to mention. And then there was severe pain and bleeding at wound site and patient calls 99 and rescue by air ambulance. You can see I'm using even present tense, but this is past visit. You cannot use present tense when you will write your letter, okay? So was rescued by air ambulance because there was no road access, okay? And the first aid was given by tour guide as patient was, on a vacation, on camping, and there was a tour guide and their, expert in giving first. The guide removed his hiking shoes and socks. He washed. I'm using present tense, but you don't need to use present tense because you will be writing this letter in the past visit, okay, in the past tense. But when I am writing, for me, it is, as I'm writing at that time, okay. So in the first aid, you removed hiking shoes and washed by it with water and soap and cover with clean and dry dressing. Okay, so this is what happened at 11 a.m. Then, sorry, at 10. Okay, then after 30 minutes at 10:30, the air ambulance arrives. Now the bite side started having, symptoms of infection. Even we cannot get infection in 30 minutes. Just to make it, just like a letter. So that is why I have written it. So now bite side has, some changes. There is redness, there is swelling, there is bruising, there is severe pain and tenderness. Even it could be in 30 minutes, it could be. And also patient is having some, systemic symptoms, labored breathing, disturbed vision. This is the examination. You need to see what is abnormal in examination. O2 saturation is low and BP is low. Other things are normal. So you need to mention just the abnormal things. Don't mention the normal things. There was a weak pulse and knee reflex was decreased. Assessment was possible neurogenic shock. Reason was snake bite. And then you have given morphine, fluids, oxygen, and you wash the wound with normal saline. Antiseptic dressing was applied. Who is doing this treatment? Who is doing this treatment?
Air ambulance services. Yeah.
Yes, air ambulance staff. Okay, so people on Facebook, if you want to write something in the chat, I can see your comments also. So we have 55 people with us on Zoom and 14 with us on Facebook. So if you want to mention anything, want to participate, you can write, okay, in the chat. Okay. So now what happens next? At this time, 11, now you have reached at the hospital, okay? The pain has decreased. No, there is no bleeding. Pain has decreased, there is no bleeding. And something new is tingling in the right foot. Range of motion of right knee has decreased. And now knee reflex was absent, was decreased that time. Now it is absent. There is ptosis. Ptosis is just, closing of eyes. And slurred speech. Okay, I should have written something simple here in the bracket. Okay, anyway, and slurred speech because nurses I will also write. Okay, then in the examination you can BP is improved, oxygen is improved. Okay, and vitals are almost okay. But the new thing is there are some blisters of 1 to 2 centimeter on the right foot and leg. And then you have assessed the patient and your assessment is, snake bite, but there is some specific thing. This is not a simple snake bite. This is a neurotoxic snake bite. And you have given morphine again. You have given antivenom. This is the, specific treatment. 40,000 international units in infusion, diluted in 500 ml Hartmann solution. And we have given booster dose of vaccine. Do you think is important when you are writing discharge letter? Is it important to mention morphine dose? Is it important to mention the dose and infusion and Hartmann solution and antivenom? Anybody can tell me?
Yes. Antivenom can be.
Antivenom we must mention. I'm just telling details of antivenom. It was
No,
40,000
no detail.
units. It
No
was
detail.
given in
I think-
500 ml solution and
Yeah, brief summary about just medicine and pheno.
just the names, because why I'm giving the details, because these details were given because the patient was given like this. But when you are writing discharge letter, you don't need to write the detail. It was morphine again 5 milligram, it was subcutaneous, and this was second dose. You don't need to this. You don't need to mention these were 40,000 units. Even if you want to mention units, but don't mention it was diluted, it was in the form of infusion, it was diluted in 500 ml Hartmann solution. And the booster dose of tetanus is also important because the patient last dose of tetanus vaccine for the patient was 11 years ago. is more than 10 years. Okay. Now this is today's visit. If you see 24, and if you see the discharge date, okay, I have not mentioned discharge date, but if it is not mentioned, the last visit would be today's visit. Okay, so today is 24th. No patient has improved. There is no fever or bleeding. And what about wound? There is no redness, no bleeding, no swallowing, no discharge. Vitals are normal. General physical examination normal. Neurological examination normal. A range of motion, ROM mean range of motion of right lower limb is normal. You don't need to mention each and everything. Yeah, his examination is normal. Okay, why I am writing all of these things? So that you can get confused that you need to write each and everything. Just his examination was normal, unremarkable. Discharge plans meter signs of infection and daily neurological examination, daily dressing for next 5 days. Okay, so we need to do daily dressing for next 5 days. So this is the plan. We need we want the reader, that could be GP, and that is GP in this case, to monitor the signs of infection and daily do the daily neurological examination, in which condition doses are important. If the doses are important, if the reader of the letter needs to know about the doses. For example, if you have treated a patient with pneumonia and you have given IV a comoxiclav and the patient was discharged, and after discharge patient will continue augmentin, okay, oral, or patient was given augmentin during hospitalization, now he will continue after discharge also. In that case it is important. Okay, so it would depend case to case. Okay, there is no rule. Okay, if the reader needs to know, then we should mention. Okay, so these are the things that we need from the reader to do. So DrChe will be doing monitoring, neurological examination, daily dressings. Okay, so you will be writing letter to me. I am GP, and you will be sending this letter to me. Okay, so now let us start how you will write a purpose. Okay, okay, so we can start. Thank you for seeing, and I am writing. Okay, mostly at the initial stages just try to use I am writing. Okay, okay, so then is both, is nurses and doctors, is for both. This letter is for both of you. Okay, I'm writing this is, discharge letter. So instead of writing to refer, okay, so we will write a discharge letter. Some people start writing here, I'm writing to discharge. It's not good to write I'm writing to discharge. Okay, I'm writing to refer, but instead of refer, as we are referring back to patient GP, I'm writing to update you. Okay, is commonly used. On, I'm writing to update you on. This is for nurses and doctors, for both of you. Okay, this letter is for both of you. So I have written the case notes in such a way so all of you can write the letter. Okay, so I'm writing to update you on. Then we will use name of the patient, just title and the surname. You know what is surname?
Miss White.
Yes, White.
Miss
White.
White. Okay, Miss White. Good. Miss White. Then we need to write what was the issue of the patient. Okay, so in the purpose we write two things. Number one, what is wrong with the patient, and number two, what we want from the reader. Okay, so what is wrong with the patient? Mostly what we write, who has sign and symptoms suggestive of, who has sign and symptoms consistent with. Okay, so our assessment is snake bite neurotoxic. So our common style is like this. Okay, who has sign and symptoms of things, no signs. Sign and symptoms consistent with neurotoxic snake bite. Can we write like this for snake bite?
No.
Even if it is a referral letter, even if it is a referral letter to a specialist, still we cannot write like this, okay? It's not good. So what we should do? Can anybody tell what we should do? What we should write?
Who has been recovering from neurotoxic snake
Who has
bite?
been recovering from, it could be,
Who
but
has
it could be
treated,
improved.
who
I'm
has
writing. I'm writing to
Who?
inform you regarding Miss White.
Uh-huh.
I'm
Then
writing to inform you regarding Miss White, who is being discharged today, and being presented with being diagnosed with neurotoxic shock due to snake bite. Thus, your further follow-up would be highly required.
Who has been treated for neurotoxic shock due to snake bite and is scheduled to be discharged today.
I think this would be one of my VIP hybrid course student. I don't know who is this. Who is this?
Means the last one.
Yeah.
The last one.
Yes. Who told this? Who has been treated with this?
Sir, I am Dr. Momal, sir.
Yeah, I can even I don't know who is this, but I know this is one of my students
Hello,
because
sir. How
you
are
know
you,
the way
sir?
you told. This is our style. Okay, fine, thank you. So the way you told me, this is what the style we use. Okay, in our letters, in our VIP hybrid course. Okay, Dr. Mumal, you have joined my course in I think in September. Yeah,
Yes, sir, exactly.
before I went for the exam.
Yes, sir.
What you got in writing? What was your score in writing?
Sir, I scored in writing perfectly. Fine.
Perfectly mean how much? Just to other for other people.
Yes, sir. 360. Yes, sir, I scored in.
360 is good. 360 is good because we need 350 to
I
pass,
also
and
scored
you
360, but I was unable to score in listening actually.
yeah, just I know sometimes we get problem with reading and listening. Nowadays it is getting a little bit of problem. And Dr. Momal, anything you can mention about the VIP hybrid course just in 1 minute so that people what
Yes, sir.
was
I
good
think
thing, what was bad
it's
thing?
brilliant to practice with you in a VIP hybrid course because it resolved my millions or numbers of confusions.
So feedback is individual. I will mark your letters like this individual. And how many letters you have written in the
Oh,
course
in the
almost?
course in the course 14 letters, but
And after that,
in totality around 25.
around 25. Okay. So this is, I keep helping my students until their exam mostly if I'm not busy. Okay. So let us see who has been treated. This is what we commonly use. Who has been treated for neurotoxic snake bite. Okay. Then any nurse. Okay. Let us take some nurse. So any nurse can tell me what we will write next, what we need after discharge. Okay. So we will write she is being discharged today. She is being discharged today. And then what we will write? We can see from the notes.
And
Maybe it
and
didn't
she
mention
requires
anything.
further care and follow-up.
Yeah, it is written here, further care and follow-up. Okay. So what is the difference between further care and follow-up? The same things. Okay. Just write one of them. Okay. And your further follow-up, your further care or your follow-up. Okay. Care would be highly Appreciated. Okay. So in the purpose, we need to mention two things. Number one, what is wrong with the patient, and number two, what we want from the reader to do for this patient. Okay, these two things we need to write in the purpose. Okay, so somebody has written purpose in the comments. Okay, so it is okay, but I have your letters, I will mark them. Okay, at the end. Okay, no, done with the purpose. Please remember, if you don't write a good purpose, you will not be able to get your required score. Okay, for example, if you are a doctor, you will not get B grade. If you are a nurse, you will not get C plus. If you don't write a good purpose, if you miss any of these things, if your purpose is not clear, if you mess up your purpose, so then you will get some problem with your score. Okay, because purpose is very important. You should get at least 2 out of 3 in purpose. So purpose has total 3 marks. So you need to get at least 2 out of 3 in purpose to pass the, okay, your writing. Otherwise, even if your rest of the letter is good, you didn't get at least 2 out of 3 in purpose, you will not get your required score. If you are a doctor, you will not get B grade. Okay. Now, let us move to the next. What we need to write now. So how we will organize the letter is important, because we have here, we don't have visits. We have, times. What happened at 10? We have 2 dates, 20, date of admission, and then we have date of discharge, 2 dates. But we have 3 times, 10 a.m., 10:30, then we have 11 a.m., and then we have today's visit. Okay. And we don't need to write here that, previous medical history, past medical history. These things are not important. So how you will organize the letter? Okay. You have written the purpose. After purpose, what we should write? Today's visit or any of above? Anybody can tell me?
Today's visit.
Today's visit?
So we can
We
go
need
in
to
a chronological
expand the
order
we need to
as
expand the
what
purpose.
referral letter. So it's a discharge letter. So we can start from the original thing from 10 a.m.
Okay, good.
on.
Okay. Yeah, but okay. So is chronological order that we call as chronological order. Okay. Chronological order means what happened from the start, then what happened, then what happened. So we can write one visit of 10 a.m. Then we can write a separate paragraph of 10:30. Then we can write a separate paragraph of 11. Okay. Then we can write today's visit. And what we can do in today's visit, we can adjust the discharge plan in today's visit. Or otherwise you can write discharge plan, then you can write the conclusion. Okay. But mostly I think here it would be better to write the conclusion as a discharge plan. Okay. So let us see what happens. No, you need to write this. If you write this visit, complete visit, if you write all of this complete visit, I think nothing is almost irrelevant. Okay, just you need to make things concise. All things are important here. All things are important today's visit. If you write almost each and everything that is important, your letter would be almost 300 words. Okay, almost 300 words. When I was just writing the model answer, when I started writing, even I was trying to make it concise, I wrote 280 words. Okay, as I was not just practicing like a real exam conditions. Okay, so that is why I wrote a little bit above. So then I realized that as my letter is long, then I try to make it concise. Okay, so this is important in this letter. If your word count is above 220, you will not get your required score. Okay, if for example, if a doctor is writing 250 or above, 240 or above, you will get C plus. If a nurse is writing, word count like this, you will get C grade. Okay, so the conciseness, one of the main issues in this letter is number one, how to write the purpose, because it's very difficult to write the purpose. And the second difficult thing is how to write, how to make it concise. These are the two main issues of this letter. Another thing is the time. Okay, mostly when you use time, we need to use at this time, not on time. We use at. That is why we are using this time, so that you people can adjust what happened at that time, not on this date. Okay, at this time. With time we use at, and with date
On.
On.
on. Okay, and with month June 2020, like this, in. Okay, okay, and with year also in. Okay, with month, with year. Okay, so let us see about today's initial visit. What is important in initial visit to mention for the reader? For example, I don't know, I'm DrChe, I don't know about this patient. So you are writing this letter to me and you want to inform me about what happened in this child letter. So what you will write? What is important in this visit? 10 a.m. I mean this time. What happened at 10 a.m.? What you will write?
With what complaint he visited you?
What, please?
Clotting.
What you will write? I am asking what is important in this visit to mention in this time.
The important the first aid by tour guide.
First aid by tour guide. What else you will mention?
The snake bite, the main event.
Snake bite. Snake bite is important. What happened?
Yeah.
Okay. So what happened? Even you can mention what he was doing. Okay. Okay. And then, you know, what about severe pain and bleeding?
Not necessary.
So we can
You
just
can
mention
skip.
this. We
Yeah,
can
is not, yeah, is not irrelevant, but you can skip. Okay. 99, call 99, even it can be skipped, because when you once you mention he was rescued by air ambulance, it already means that they called the 99. You can skip call 99. You can just mention air ambulance. Now next problem is, so here you mention snake bite. Zoom link is in WhatsApp groups. So if you need to join the WhatsApp group, somebody is asking on Facebook. Okay. Okay. So okay. So here the important thing was bitten by a snake bite. We will not mention snake bite. Was bitten by. We need to use passive voice. Okay. Was bitten by a snake. By a snake. Okay. While he was camping in the desert and was rescued by ambulance. We can skip these things. Bleeding, pain. When I wrote first time, I wrote all of these things, but then I realized it was too long. Okay. This initial visit, you don't need to make it too long. Okay. So then what happened? Well, you will so most of you, when I will mark your letters, you will see that most of you will be writing, you know, the tour guide removed his hiking shoes and socks, then he washed his bite with water and soap, and he covered it with clean and dry dressing. So most of you will be writing like this. So if you write like this, you will be, this visit would be almost more than 50 words. Okay. So we have 50 words here, then we have, you know, 80 words here, then 80 words here. It will become too long. Okay. So what you can write instead of just writing the detail of first aid?
No, that's
What
not
you can write?
necessary. First
So we
aid is
can
not
just
necessary. We can
first
skip
aid
First
was
that.
aid
given.
was provided by the tour guide.
What, please?
First aid was provided by tour guide. That would be enough, I guess.
Yes. Or
It's
she
enough.
was given first aid afterwards. I
Just
think
1
that would
minute.
be enough.
Okay. So now let us continue. By the way, you know, people, I live in the hospital and you know, I need to write sometimes a slip. I need to sometimes see a patient. So if I go for 2 minutes, 1 minute, you don't need to leave the class. Okay, so let's try to write this. One version of this is to write like this. Okay, at even we need to mention that on this date, on 20/11/2022 at 10 a.m. or we can mention within the sentence, Miss White was bitten by a snake. Okay, we need to use article with snake. Okay, by a snake while camping. Okay, even we can skip the desert. Okay, while camping, if you want to mention in a desert. Okay, because it will come to in a desert. Okay, we mostly the nurses make this mistake. They don't use passive voice here. Okay, so the active voice is the snake bite the person Miss White, but here we need to use passive voice. The Miss White was bitten by a snake while camping in a desert. Okay, so now the next thing we need to mention two things. Okay, I have already shared the case notes in the WhatsApp. Okay, so if you don't have, you can ask me at the end of the class. Okay, now we need to mention two things. Okay, no, let us continue. Okay, okay, he had severe pain and bleeding at wound site. Okay, he called ambulance, or ambulance was called. He called 999 and was rescued by ambulance okay, rescued by air ambulance as there was no road access. Okay, he was this is just a version. He was provided first aid by his tour guide, including okay, Okay, we can tour guide who? Okay, tour guide. Who removed his hiking shoes and socks. Or even we can write one sentence here and then we will continue here. Okay. His wound was washed with water and soap. Okay. Then I've added the last thing.
He was
You
provided.
can just join here. No, he was covered with a clean and dry dressing. Okay. So what I have done is I have written each and everything what is written. Okay. I have written each and everything what is written in that visit. Okay. So now this visit is 71 words. How many words? 71 words. Is there any grammatical mistake?
No.
Almost no. Okay. Could be some minor mistake because overall we are doctors. We are not English teachers. Okay. So yeah, but here she she yes. People, English means grammar, vocabulary. Okay. Yeah, I have corrected. So grammar, vocabulary, these just one of the 6 criteria. So you have 6 criteria in writing. So one of them is grammar, vocabulary, okay, punctuation, all of these things, just one of them. So you have 5 other criteria to fulfill to get the required score. Not only grammar, not only your tenses, your punctuation. This is just one of 6. Okay. So now we have 71 words, but we don't. If we keep writing like this.
Yeah, excuse me. Air
Yes,
ambulance. Air ambulance by a capital letter or small?
A small. Okay, you don't need to write a capital. Okay.
No need to
Even
write
we need to
N.
write an,
N here.
yes, an ambulance. Yeah, an air ambulance. It should be written an. Okay.
It is
So now
important
you have
to
72.
sorry, is it important to mention
Just
on the right
let me
foot?
explain. Then you people can ask questions.
Okay.
Yes. Yeah. By a snake. Oh, okay. Okay. Yeah. By a snake on his right foot. Okay. So now your word count would be close to 80. Okay. It is not counting here. It is not counting, but it would be just almost 80. Okay, let's write 80. Okay, almost. So you have 80 words here. So do you think if you write 80 words in the first visit, how many words you will write in the next visit in which you have to write examination, you have to write the treatment, how many words you will write in the next visit? 80 or more, okay, not less than 80. Yes or not? Then you have another visit in which you again will be writing 80 words because it is also too long. 80, 80 and 80 is 240, okay? And then you need to write today's visit discharge plan. You will write at least 50 words. And then you will write the purpose. You will write 30 to 40 words. So your letter would be more than 300 words, okay? So that is why we need to make this part concise, okay? Now let us try to make it concise. Okay, so this sentence is okay. This white was bitten by a snake on his right foot while camping in a desert. Okay, good. Then I will write, she was rescued by an air ambulance. Some people can say, we don't need to mention this ambulance, we don't need to mention this and that, but at least you need to write something to make a story, okay? So the reader wants to know a little bit story. You can write the discharge letter like this, okay? I am writing this letter. This patient was diagnosed with, was admitted with a snake bite, now is being discharged. Please continue his dressing and do this. But the reader, this is a formal letter, the reader want to know about the, details. This is a formal letter. You need to write at least 180 to 220 words, okay? He was rescued by an air ambulance and okay. So first is okay. So let me tell you, first is first aid or first is the air ambulance. What is first? We have two things.
First aid. First aid.
We have provided first aid and we have rescued the patient by air ambulance. What is done first?
First aid.
First aid,
Rescued.
okay? No, first aid.
First aid by
First aid is by the guide. Tour guide is with him, with her. And in the next, these things are done by the air ambulance, okay? Air ambulance staff, okay? But this first aid is by the tour guide, okay? So this is provided first, okay? I will write it first, okay? First aid was provided by her tour guide, and she was rescued by an air ambulance, okay? So now we have 34 words. And here we have 80 words. You can see the difference. All of you mostly, especially doctors and many nurses also. So the knowledge that you have about English already is enough to get C+ in case of nursing and B grade in case of doctors. But just you need to use it appropriately and you need to fulfill the criteria that OET writing demands us to do. Now, if a doctor is writing this letter, I will give C+. This is not concise. This is B grade, okay? Can you see the difference, please? Any of you can tell me what you have learned, but by the comparison of these two visits, these two paragraphs. Any nurse?
concise.
Conciseness, okay? This is one of the most important thing is conciseness, okay? So then in the next visit, you will write air ambulance arrived. You don't need to write again because you have mentioned she was rescued by air ambulance. So you don't need to mention again because I was trying to write. I was not able to adjust it in a sentence. So I skipped it, okay? Then I will mention what were the new symptoms: redness, swelling, bruising, severe pain and tenderness in one sentence. Or you can mention, labored breathing and disturbed vision in the same sentence or as a separate sentence. And then mention what was positive, just positive in the examination, okay? And then write what was suspected and then just write the treatment. Just write their names, okay? Don't write the details, okay? It means the diagnosis, doses and these things, okay? So just write there. This is what I do when I take classes of VIP hybrid course. I give them model answers, okay, like this, okay? So let me see what I have written here in the second per letter. Okay, 32, 9 words. Okay, anyway. Okay, so this is at 10:30. She had signs of infection along with labored breathing. Yeah, this is very important. Okay, when I wrote this letter for the first time, okay, I'm just saying the honest thing. I don't need to lie anything. When I wrote first time, I have written like this. Okay, at 10:30. Miss White has redness, swelling, bruising, severe pain, and tenderness on her wound site. She also had labored breathing and disturbed vision. Okay, so how many words would be there? Almost 30 words, 30, 35 words. I wrote like this. Okay, at this time, Miss White had redness, swallowing, bruising, severe pain, and tenderness on her wound site. Also, she had labored breathing and disturbed vision. Okay. So here I should have written in the bracket signs of infection because I was just planning to write it, but I forgot. Okay. Here in the bracket, I should have written signs of infection. Okay. So let me write them. Just 1 minute. Okay, in the model in the case notes, okay, with this I should write in the bracket signs of infection. Okay, then it would be easy for you to just write signs of infection instead of writing all of them. Okay, and let me correct here is 1982. Okay. Okay, so then you can see I have written here. Sorry. At this time, Miss White had signs of infection along with labored breathing and disturbed vision. Very easy, very concise. Okay. Okay, signs of infection along with labored breathing. Okay. There's some mistake here. Okay, sings no signs. Okay, sorry. Thank you. Okay, so next you will write, examination. You will write what is positive in examination, and then what you have assessed and what you have given the treatment. Okay, very easy. Let me show you here. Sorry. Okay, her BP and oxygen saturation were low. Let me tell you again here. When I wrote for the first time, I have written, blood pressure, its value, saturation, its value. Then it became too long sentence. So what I have done in the rewritten, her BP and saturation, O2 saturation were low, just and her knee reflex was decreased. Neurogenic shock was suspected, and she was given morphine, IV fluids, O2, and her wound was treated accordingly. So instead of just writing, dressings and these things, nervous line, antiseptic, just write wound was treated accordingly. Okay. And you have given morphine, oxygen, IV fluids, just to make it concise, because overall this is a discharge letter. Okay. So then we have next visit. In this visit, patient reached at hospital. You can write it. The main thing is what are the symptoms. Okay, pain has decreased and she has no bleeding. But the new thing she has is tingling. We will write a tingling sensation in right foot, and his range of motion of right knee has decreased. And on the examination, these things are absent. Okay, right knee reflex is absent, and there is ptosis and slurred speech on examination. Vitals are normal. You can skip, and then next is just you have on examination there were blisters on the right foot and leg, and the assessment we have already mentioned the purpose, and then we will mention the treatment best concisely, the treatment. Okay. At 11 a.m., Miss White was brought to our hospital and her pain was decreased, but she had a tingling sensation in her right foot, ptosis and slurred speech. So how you can see, even it is a little bit long sentence, but it is well organized. It is easy to understand. Okay. Her range of motion of the right knee was decreased and the knee, okay, range of motion separately and the right knee reflex was absent. She also had some blisters, okay, 1 to 2 centimeter, and was given antivenom and a booster dose of that. Even I skipped the morphine again because it's not too important to mention the morphine again. She was given antivenom and a booster dose of tetanus vaccine. So in today's visit, very concisely, I have just written, Miss Y's condition has improved today as her examination is normal and she has no signs of infection. Okay. Yes. So when you are reading the letter, that is good. Okay. So when you are reading this, you can see here, I have written redness, swelling, bruising. Okay. Severe pain and tenderness here. But if you see here, I am giving you the clue to use signs of infection. So no redness, no discharge, no swelling, no bleeding means signs of infection. So you can use this bracket. It was already in your letter. So you can use this signs of infection. Okay. Instead of writing all of them. Examination normal, signs of infection. Okay. No signs of infection. Okay. Her examination is normal and she has no signs of infection. So then the conclusion, I would be grateful if you could monitor her for signs of infection and do her neurological examination and dressing daily for the next 5 days. So this is the conclusion. Okay. So now let us mark letters. Dr. Hashita is there. Dr. Hashita from Sri Lanka is there. Dr. Hashita from Sri Lanka is there on Zoom or on Facebook. Yes or not? Please write something in the chat if you are there. If you are not there, then there is no need to mark your letters. Are you there? Okay, no. Miss Annaline is there? Miss Annaline? Miss Annaline is there? No? Miss Annaline? Johnson, who is Johnson here on Facebook? Write your name, okay? And Dr. Hashida is there, okay? Okay, good. If you want to talk, you can unmute, okay? So I'm Dr. Let me Annaline, okay, good, good. Annaline. Okay, so here you need to leave one blank line before and after date, okay? Before and after date, you need to leave blank line, okay, doctor? So rest is okay.
Yes, thank you.
Yeah, everything is in capital, that is good. Now let's count your words. 164. It is a little bit less. You should write at least 180 to 220, doctor, okay? 180
Word
to
count
220.
comes from only the body of the letter. Yeah, is that
yeah, body of the letter, okay? Not
okay.
197, okay? In total, it is 197, but your word count starts from here. Thank you for accepting. I am writing. And even this large sentence is not included. Please do not hesitate to contact me if you have any further queries. This last sentence is not included in the word count, okay? So is 164, okay? So please write at least 180 to 220, okay? At least 180. Thank you for accepting Miss White, okay, back into your care, who has been treated in our institute for neurotoxicity following an unknown snake bite. That is good. You have written what we want, what is the problem of the patient, and into your immediate care. I would prefer after Miss White, we should write directly who, okay? Like this. Thank you for accepting Miss White, who has been treated, okay, in our institute. Even we don't need to write in our institute, okay, because we need to make things concise. Was been treated for neurotoxicity following an unknown snake bite. Even we unknown is not needed. Snake is unknown. You cannot snake cannot be a pet, okay?
Okay, yeah.
Snake is always unknown, okay? So by a snake bite, okay? Following a snake bite, okay?
Okay.
So this is your first part. What we want from what is the problem of the patient. Now you need to write the second part. Why you are writing to me, to Dr. Che? Why you are writing? Why? What you want from me?
Yeah. So
Okay.
yeah. Okay. Yeah.
So this is mentioned in your case note. It is mentioned already. For further care and follow up. You don't need to use both of these words. Just use further care or just use follow up. Okay, one of them, not both of them. On 20 November morning, Miss White was suffered, is not liked by OET, okay? Was suffered, is even suffered is not, this is not suffer from fever, okay? So please avoid using word suffer in your all OET letters, but here it is totally not good, okay? We don't use was suffered snake bite. They suffer from fever, suffer from cough like this, but here suffered was bitten by a snake, okay?
Bitten, yeah. Okay, yeah, sure.
On a ride forward while camping in a desert, she was airlifted and transferred to our hospital within one crew. Very good. Overall, your conciseness is very good, but don't make it over concise, okay? So even you are not mentioning what is happening at every time, okay? Still your letter is good because you have mentioned within 1 hour. People, this is very good, okay? This paragraph is very good, okay? She had features of neurotoxicity such as tingling. Tingling sensation. We don't directly use the word tingling, okay? Even it is medical, but this is also an English exam, so people need to be careful about the small things. Okay, degree range of motion of right knee, absent right knee reflex, ptosis, and start speech. Very good, good organization.
So
yes,
it is the tingling word. Tingling was in the case notes. So can't we use that?
Yes, it is written. Tingling sensation. Tingling directly is not good to write. Tingling. We need article and we need sensation. A tingling sensation. Okay, so degree range of motion of right knee. So this is good sentence, by the way, and don't use she at the start of new paragraph. Okay, use name of the patient. Okay, she was saturating at 98%. Even grammatically, it is not a problem, but medically, we don't write like this. Okay, so what you should write?
Her saturation was. Yeah, saturation.
Make it
saturation.
easy. Make it easy. Yes, our oxygen saturation was 98%. People, believe me, many students fail in the OET because they make things difficult in OET. You need to make things easy so that you can pass. Okay, please. Okay, so with the blood pressure after 1 liter of fluids. So this part you are not adjusting. Yeah, this is not you suitable grammatically here. You cannot adjust after 1 liter of fluids. Okay. Her saturation was 98% with blood pressure of 1 after 1 liter of fluids. You need to mention what was the low BP, and then you need to mention how it is increased and what is the current value. So this is not clear. You have not made it clear why you have given fluids. Okay, so she was given antivenom with a booster dose of tetanus vaccine in addition to analgesics. So the problem is you're making it over concise. This is also a problem. Okay, she is improved today with no features of again. Okay, today means what has improved, her condition has improved today with features. The features, you can see repetition here. Features of. This would be irritating for the reader. Just make it simple. How you can make it simple? Today, Miss White has no fever, vomiting, or signs of wound infection. Okay. As you already know, she has no. This is not needed. Okay.
Yeah, sure. Yeah.
This is not needed. Okay. Please be assess a neurology. This is grammatically wrong. Okay. Assess her neurologically, maybe like this, or do her neurological examination and dress her wound daily. That is good. This part is good. So even I know your English is good, okay? Because writing a letter like this very concise is difficult, okay? Even for me, your English is very good, but this letter is C+, okay? So this is the reason we need to fulfill their criteria and not make grammatical mistakes. You can easily get B, just you need to focus on these things, okay?
Okay, sir. Thank you.
So next letter is Miss Annaline. Okay, Miss Annaline, first your word count 226, okay, is okay. And the problem is even your word count is okay. People, you can see this paragraph, 111 words. Okay, it's not good to write a long paragraph like this. Okay, you can divide it like this. Now it looks good or not? Apparently, looks good or not? Look at the difference. Okay, look at this. This is 2-line paragraph, 3-line paragraph, 1 line here, 2 lines here. This is 1, 2, 3, 4, 5, 6, 7 lines. Okay, and now look at this. It looks very equal. Okay, I'm writing regarding Miss White who has been treated, had been no, who has is commonly written has. Okay, for snake bite we don't need to write in capital. I'm writing in the case note because these are case notes. This is not a letter. Capital, even I write capital so that you people can get confused. And in the real exam or in the you know in the case notes, official case note, they write like this, the diagnosis, but you need to write it small. Only we write in capital if the name is given after someone's name, okay? Initially on this stage, Miss White was bitten by a snake. Even in the model answer, what we can do is, we can skip she is being discharged today. Okay, but anyway, it's not too long. Okay. Usually on this, at this, okay, just try to write the time in better. Okay, so Miss White was bitten by a snake in the camping desert. Okay, she had severe, okay, this typing mistake, no need of pain and bleeding at the wound. A first aid was initiated by removing. You can see people, I was saying people will do this. Okay, you can see the details, 50 words. First aid was initiated by removing socks, hiking shoes, and washed the bitten area with a clean water. With a clean water, we don't need this article, clean water. Soap was clean water and soap, okay, and soap uh, was covered with clean dressing. So this sentence is too long, okay. Please don't make it difficult like this. Okay, make it easy. After some minutes, okay, ambulance came. Air ambulance. We don't need to write it capital. She had labored breathing, decreased vision, and her vital signs showed. You don't need to write Miss Anna in all the vital signs. Please just write the abnormal one. Okay. She also decreased, increased redness, swelling. Okay, okay. Decreased with ED. Please mute. Please mute. Decreased knee reflex. And infusion was given, and morphine. Morphine we need to write as small. Okay, this wound side was cleaned and antiseptic dressing was applied. Okay, right, reached the hospital. Pain was decreased with limited range of motion of right knee, absent knee reflex, ptosis, and slurred speech. By the way, she is one of my VIP hybrid course students. She is trying very good, but still we need improvement. Okay. She had multiple blisters on right foot and leg. Okay. She was given second dose of morphine, antivenom, and a booster dose of tetanus vaccine. Yeah, this paragraph is good. Okay. After 4 days, she has made. Okay. I would prefer has made. Good progress with no signs of infection. Very good. In light of the above, please monitor for signs of infection. And daily neurological examination. Monitor her. Okay. Monitor her. Please continue the daily wound dressing for the next 5 days. Good, Miss Annalene. Good overall. I can give you C plus, but you need to improve a little bit more. Okay. So Miss Princey is there. Miss Princey from India. Miss Princey. No. Miss Princey from India. If you are on Facebook or if you are with us, please write something in the chat. Okay. Miss Anita and Dr. Sunanda. So any of you is there?
I'm there, Dr. Sunanda. Anita
Miss
is
Anita
also.
is there? Miss Anita.
Yes.
Both of you are there?
Yes, I
Okay.
am there.
Anita and Sir
Sunanda.
Sunanda. Okay. Both of you are there. Okay. Okay, good. Miss Anita, you are writing very good, but please keep practicing. Okay. You're one of VIP hybrid students, so you can send me more letters without paying extra. Okay. By the way, just remember this. For VIP hybrid students, I don't, keep earning money from them. Once they join, then I keep helping if it's possible for me. Okay. So this is Miss Princey, yeah? No, Miss Anita. Miss Anita. Miss Anita, just please keep blank line before and after date. Okay. I am writing to refer Miss White. Let's count words. Your word count looks okay. 220, 14 or 214. Okay. I'm writing to refer Miss White. We need comma here who requires further assessment and evaluation. She has been recuperating from snake bite. I prefer to write what happened first, and then I prefer to write, okay, what we want from the reader, okay?
Okay, sir.
First, what happened with patient, and then write what we want from the reader, okay? Please. It looks a little bit illogical, okay? Without writing what happened, then you are, and has been recuperating is also not good. I will prefer who has been treated for more bad luck better, okay? Miss White was bitten by a snake while on camping in desert. In a desert, we can use even article while which was resulted in. This is common mistakes are of nurses. Okay, it would be a nurse. Okay, you people can see the nurses make these mistakes. Okay, which resulted in, which we don't need was. Okay, just which resulted in. No need of pacifies in severe pain and bleeding at wound site. Immediately her wound was washed with soap and water, followed by clean and dry dressing. This is also very good. Concise, 38 words, good. But don't make this grammatical mistakes, okay? Subsequently, you should need to match a little bit the timing is good too. It would look better, okay? Subsequently, air ambulance came. You can see I told I was not even able to adjust this air ambulance came, okay? This is very simple sentence. Skip it. Write something here or skip it, okay? Or adjust is with something else. So you can write a compound sentence on observation. We can examination. No need for observation. She was found with. These are her symptoms. You don't need to write as examination, please. Okay, don't write as observation. Yes, she had labored breathing and disturbed vision associated with signs and symptoms of compromised circulation. You cannot use write like this. Okay, signs and symptoms compromised circulation. What do you mean by signs and symptoms of compromised circulation? Please don't make like this. Okay? Just write what is written positive. Okay. Write her blood pressure, write her saturation, and don't write, over concise like this, associated with symptoms of compromised circulation. The reader will not know what you mean by symptoms of compromised circulation. This is OET, not medical. Okay. Her vital signs are remarkable, with weak pulse, decreased knee reflex in the affected leg, which was possibly due to neurogenic shock. This was not only possible due to neurogenic shock. These things were also due to neurogenic shock. Okay. So please don't just label these things for neurogenic shock. Okay. So you will write at the end, neurogenic shock was suspected and she was treated with this, and this. Okay. She was commenced oxygen therapy accompanied by morphine, subsequently intravenous fluids. Okay. In addition, antiseptic wound dressing has applied. This is visit is in the past. We cannot use present tense. Okay. Is wrong. Okay. After saline wash. So you need to improve. This paragraph is not good overall. We need to work a lot on this. Okay. After an hour, Miss White was brought to hospital with definitive symptoms of. You cannot write like this with symptoms of. You need to write which symptoms are there. Okay. We cannot overall like this. Okay. Patient came with symptoms of TB. Patient came with symptom of pneumonia. No. Write the symptoms. Okay. But concisely. Consequently, she was managed with morphine. You don't need to write the second dose. You don't need to write a Hartmann solution. Booster dose is okay. Condition is improved, is okay. Okay. So overall, I will give you C grade. Okay. Your English is not bad. Just you need to improve a little bit more to get C plus. Okay. So just compare with model answer, compare with others letters, other people who are writing letters, and improve a little bit more, please. Okay. Then we have Dr. Ananda. So where are you from, doctor?
India, sir.
Okay, good. Okay, Indian doctors are good in writing. Okay, this letter would be very good, I think so. So I'm writing to update you regarding Miss White, who is your word count is okay. Who is admitted now? Even admission was in the part. Who was admitted? I would prefer who has been treated, who admitted with snake bite and being discharged today into your care, your follow-up care. Into your care is not needed when you're writing follow-up care in the next sentence. You don't need to into your care. Okay, your follow-up care, and we can use hyphen between follow and up. Your follow-up care and management would be highly letter. This is a discharge letter. Okay, just make it simple. Okay, your follow-up care would be highly appreciated. This is follow-up care. Okay, no, management is not good here. I am not saying is wrong. Okay. On this date at 10 a.m., Miss White had a snake bite. Is not wrong. I would prefer was bitten by a snake. Had a right foot while camping in our desert. There was severe pain, bleeding at and bleeding, common and bleeding. The wound was washed with water and soap along with dry dressing and immediately arranged for ambulance. Okay. And this is not immediately, and if you want to write arranged, and an air ambulance was arranged. Okay, would look better. And an air ambulance was arranged, but even it is would not look good. Okay, this is why it had labor breathing, disturbed vision, and swollen wound side. Okay, you can write just signs of infection as I mentioned. Our blood pressure was low with feeble pulse, low saturation, along with decreased reflex in the right leg. This is good. Oh, this is good. Okay. Neurogenics was suspected, started on analgesic IV fluids. Okay. Who is starting on her on these things?
The ambulance in the ambulance, yeah.
Okay, ambulance. Okay, so we cannot start right the ambulance. The air ambulance staff started her on this and this. It would not look better. So what we should use? Passive voice. Okay. She was started on. Okay. So grammatically, your sentence is wrong. Okay. as the original was suspected, she was started on this, and wound was washed, okay? And wound was washed with normal saline, antiseptic testing was done, okay? You can make it a little bit more concise. Arrived at hospital. You can write a little bit more, is too short, okay? So you can see both of these two sentences are simple sentences, is very simple sentences. You should join similar information to write good sentence. Her vitals were normal, okay? Again, simple sentence, very simple sentence. Her right leg had this. Okay, Miss White's condition is stable. She needs monitoring of signs. Okay, your conclusion is not typical as we mostly write. Okay, your letter is not bad. I will say close to B. Okay.
Okay, sir. Okay, thank you.
Not B grade, close to B. Okay, I am not saying C plus. Okay, for you, I'm just saying close to B. Okay, borderline B, 340, 50 like this. Okay. So, Miss Kiran, can you hear me? Are you there? So, without reading this letter, what should be the score?
Yes, sir, I'm here.
So, people, without reading this letter, what should be the score?
I think C.
C, because the word count is 329. Okay. So, let us count here the body 296, almost 300. Okay. So, this is what this student will do. I will say what she will do is she will start like this. Okay. She will be doing like this. On this stage, she was bitten by a snake on right foot while she was camping in desert. She had pain and bleeding at wound side. She called 999 and was rescued by air ambulance. There was no road access. She was given first aid by tour guide. He removed his hiking shoes and socks. He washed his bite with the bite site with water and soap, and he covered or she covered it with clean and dry dressing. This is what she will be writing, each and everything. Okay. Who presented with snake bite can be improved. Okay. Today we need comma here. She is being discharged. Your for and okay, we need and here. Your further care management would be highly appreciated. Management we done it. Just further care is enough. Okay. On this to Miss White goes. Why I am using present tense in this because just for me, this is I am writing a that day, but you don't need to use present tense. You need to use past tense. Okay. This is a past visit. So she goes is wrong. We need to use she went for camping. She went for camping in a desert where she gets is again wrong. We cannot use present. Where she was bitten by a snake on her right foot, which caused, okay, which caused with ed, okay, which caused severe bleeding and pain at wound site. The tour guide removes again present tense is wrong here. Okay, removed her hiking shoes and socks and washed it by the bite site with water and soap and covered the wound with dry and clean and dry. This is what she is doing. She's writing each and everything. Okay, so we need to be make things concise. Okay, so at 10:30 air ambulance arrived. Okay, arrived, and they observed the wound side with which was red, swollen and bruised. Her vision, her O2 saturation was this, and she had wheel pulse. Okay, she was managed with morphine. So we can make it a little bit concise. We don't need to write the details of this. Okay, I wish I was clean one. Was applied. Okay, overall grammatically is almost okay. This paragraph, but you made the mistake of writing in the past tense, in the present tense. As illness arrives, and okay, this I already done. Okay, was shifted no, was shifted to our hospital. At that time our pain was decreased and there was no bleeding and a tingling sensation in right foot was decreased and ptosis, and she had, this is good, her vitals were anaerobic and she had blisters of 1 or 2 centimeters. Oh, good. She was introduced with is not needed. She was just given this and that. John write a lot of, you people can see how long you have written, okay? Just she was given, morphine, antivenom, and tetanus, booster dose of tetanus. You can write very concisely like this, okay? Ready to be discharged as she had made good progress, okay? She has no fever and vomiting, her wound has no redness, bleeding. Just write sign of symptoms, signs of infection. No need to write there everything, okay? Are unremarkable and also normal, okay? I will, if you could, okay? Okay, so the main thing is conciseness. You need to work on conciseness, okay? As you are one of my, VIP hybrid course students, old student. So please write this letter again and send me, okay? Send me again, okay? Rewrite. Okay, Miss Kiran, are you there? Not there? Okay, Dr. Dalawar is there?
Yes, sir, I will write.
Okay, please rewrite. Okay, Miss Kiran, please rewrite. Okay.
Okay, thank you, sir.
So rewrite and send me again, okay? Just send the picture of handwritten, okay? Dr. Dalawar?
Yes, sir.
VIP hybrid, okay? VIP hybrid, okay? So your greeting is okay. I am writing to update you on Miss White, who has been recovered is okay. Who has been recovered, okay? If you want to use recovered, use who has recovered. If you want to use treated, who has been treated, okay? Your further care would be highly appreciated. You can write she is being discharged today, because this looks very small sentence, okay? You can add this, she is being discharged today. On this date, got a snake bite, got a little bit informal way, was bitten by a snake, okay? On her right foot with severe pain and bleeding at wound site. Consequently, ambulance arrived and first aid was done, okay? First aid was given, okay? On examination, we need comma here. There were redness, no, there was, okay? There was redness, swelling, bruising, and tenderness on affected side. Along with her vision was disturbed. Along with disturbed vision, okay? Don't make it like difficult, like along with disturbed vision. Vital signs were auto saturation. This no need to write vital signs were like this, okay? Just directly write her O2 saturation was 88% and her blood pressure was this, okay? And respiratory rate this, okay? So no need to write vital signs were. Also, our reflex was decreased and pulses were weak, okay? Suspected knowledge. This is even not a sentence, okay? There is no verb in this part, okay? It's grammatically wrong. Neurogenic shock was suspected. Neurogenic shock was suspected and treated, and she was treated accordingly, okay? Even this part is also wrong. And she was treated accordingly. So you have written, two things together. You can write even in two separate body paragraphs would look better, okay? At one, Mr. arrived at DrChe hospital with process slurred speech, absent knee reflex, and decreased range of movement. That is good. Her examination, not only examination, her examination with multiple blisters on her right foot and leg. She was commenced on antivenom, and just she was commenced, she was given would look better. Antivenom and booster dose of tetanus vaccine was given. Very good. Vital signs are stable. Her neurological examination is normal, and there are no signs of infection on her wound. And there are no signs of infection, no need of on her wound, okay? And she has no signs of infection, or there are no signs of. We of the I would be grateful if you could monitor her for signs of infection and perform daily neurological examination. It is written something about like for next 5 days, something like that. You can add. The only main issue in your letter is this paragraph, okay? Please, these two visits are not good. You need to improve. You don't need to rewrite this letter, but please improve, okay? Dr. Dilawar, take a picture or screenshot, please. Dr. Dilawar.
Okay, just 1 second, sir.
Yeah, please.
Okay.
Please be careful. These three visits, these three paragraphs are good, okay? Purpose is also good except for this mistake of grammatical mistakes. This visit can be, these two visits can be improved, okay? Overall. No need to rewrite, just to improve, please, okay?
Okay,
And Miss or Dr. Leonora is there?
Yeah, yes, sir.
Okay. This is the last letter, then I will mark only those letters who are in my course, and then we will finish because they will not get normal correction today. Okay, so this is not needed here. There, DrChe is okay. Maybe you want to write on a separate line here. Okay, I'm writing to you regarding Miss White. Which no who, which no who. Okay. We treated for snake bite on right foot and she's ready for discharge. You need to write the second thing, what we want from the reader, okay? In this date, we need comma after date, and at this time, we need comma after time also. It was was bitten by a snake on her right foot while she was camping on the desert. She called, okay? Call is wrong, okay? Called and waited for ambulance to arrive. This is not needed. Waited for ambulance to, just you are losing your word count, okay? And your word count is 360. 322 words too much, okay? You don't need to write each and everything. They cleaned, okay? We cannot use the present tense here. The word and also covered. This element arrived, the examination was redness, bruising, painful tenderness, saturation, this. There is no verb in this sentence, okay? There is no verb in this sentence, okay? Ms. White had aneurological, her pulse was weak, her knee reflex was decreased. This is good sentence. She had, okay? This is in the past. She had labor breathing, they administered to her. Not administered to her, okay? She was given, she was administered morphine, this, okay? And given IV fluids, so improve, please, overall. Arrived at hospital, her pain was decreased and she was no bleeding. She was no bleeding, no, she had no bleeding. Reflux, okay. There are a lot of things in this sentence. She oxygen was this. She got treatment of, she was treated for this and that, okay. On this stage, she is normal stages. She is a normal stage. No. Okay, overall, this letter need a lot of improvement. What you need to do is you will write this letter again and you will send me, okay? Take a picture or screenshot of model answer, please. Just 1 minute. Okay, no, just 1 minute. Take a picture or screenshot of model answer and write it again, please, okay?
Okay, thank you.
So we are going to disappear from Facebook because it's enough for today. And we will continue here on Zoom. So